Every year we see about 1,000 young people aged 15 to 25 diagnosed with cancer, and although cancer in this age group is rare, the reality is it's the leading form of death by disease for this age group, and also we see nearly twice as many 15 to 25-year-olds diagnosed with cancer each year compared to children under the age of 14. Although the survival rate, the 5-year relative survival rate, is very good for this age group, it's sitting at about 88%. The reality is that it does mask the survival rates of the high lethality cancers, so those deadlier cancers that unfortunately are quite common in this age group. For these young people, access to a clinical trial is really their only hope. And Canteen's chair of the board, Joey Lynch, he was one such young person.
I was diagnosed with Hodgkin's lymphoma, cancer of the lymphatic system, in 2008. From around 2012 onwards, things got pretty bad. Probably should have died probably 3 or 4 times, if I'm being honest. It reached the point where I ran out of curative options in Australia and required a clinical trial that was only available in the United States.
Clinical trials are essentially the best way to discover and get access to cutting-edge treatments. But for many young people in the 15 to 25 age range, they're caught in between being too young to access adult trials and being too old to access paediatric trials.
I was very much in a privileged position, though, that I had a network of family and friends and was able to wrangle up enough support that although we did end up needing to take out a second mortgage on the house, it wasn't as large as it could have been, and I was able to go over and get the trial. But as part of that, I became involved in Canteen's clinical trial initiative. As I said, I was in a very privileged position. There's a lot of young people around the country that wouldn't have been able to marshal support, enough support to get over to the United States, which basically would have amounted to a death sentence for them, which isn't fair.
Through Canteen's groundbreaking Australian Young Cancer Patient Clinical Trials Initiative and with Commonwealth Government funding, we have funded 5 potentially life-saving clinical trials, and these 5 trials are all focused on the high lethality cancers, those deadlier cancers, those rare cancers that, as I mentioned before, unfortunately are quite common in young people aged 15 to 25. And so we are investing in a Ewing sarcoma trial, a brain cancer trial, acute lymphoblastic leukemia, and also a study that's focused on genetic profiling to help increase survival rates. All of these trials are led by the brightest minds in Australia, and Canteen is so proud to be involved in research breakthroughs that are changing young people's lives, and it just further cements our commitment to be in the corner of every young person when cancer comes crashing into their world.